Dr. Mani is not your average plastic surgeon. In the 70s, when cosmetic surgery became popular, he chose to help trauma patients.
In 1974, there was no interest in trauma. Everyone was going towards cosmetic. So there was no competition. Nobody wanted my job.
Dr. Mani was recruited from India to come to Kansas to run the KU Medical Center burn unit.
So I came on a 5-year agreement, and 5 years turned out to be 44, 45 years now.
His trauma patients faced both physical and emotional wounds. Dr. Mani worked on both, like the man involved in a welding accident.
When he got hurt on the job, we took care of him, got him well. As usual, we would say, what do you want to do when you get out? He says, anything but welding. So what are you trained to do? Nothing. Welding is my job. So we talked to him about welding for art. And if you go to Overland Park, Santa Fe Trail, and there's a circle, in the middle of the circle is a statue. Gary did that. So it is not just curing the injury, it is to get the best out of them.
Dr. Mani has kept the names of all of his patients because he held their babies, helped change their lives, and they stayed in touch with their former doctor.
And they came to the clinic, and what do you do with this baby? I said, give it to me. So I babysat when the others did all the other stuff. So that's the fun part of it. I know her name. 31 years ago, her dad was Aaron Stegmeyer.
Dr. Mani changed medical protocol too. Yeah. His team approach to medicine was groundbreaking in the 70s.
Team concept in 1974 was, The nurse was considered a handmaiden of the physician. So the physician would tell the nurse what to do. Wrong. Because why would I, as a physician, tell a nurse what to do her job? She went to school for 5 years. So I don't tell them what to do. Each member of the team had an equal voice in the management of the patient.
This emeritus professor says if he could teach all medical students one thing today, it would be
his bedside manners. Bedside manners. When you walk into a patient's room, don't stand at the doorway holding the chart in your hand and talking down to the patient. The patients are lying on a bed. Drag a chair, sit down. You're at their level. So now you are equal, not this way.
KU sent Dr. Mani and team across the state of Kansas to train doctors in any town that had a hospital. They opened a second Kansas burn unit in Wichita.
And then Dr. Robinson, my boss, my chief, said, when you're done with Kansas, plant the Jayhawk flag all over the world. So that's what we did.
The entire team set up burn units in Malaysia, Central Asia, and Australia. Travel seems to be a part of Dr. Mani's DNA, for work and for pleasure, with many family trips to Africa and Alaska.
And we trekked through South Africa, Botswana, Zimbabwe, Kenya. I've been to Alaska every year since 1975 till 2019.
Even now in retirement at Lakeview Village, Dr. Mani has travel on his mind.
I'm now talking to some people here to go to the Netherlands. If you have not seen a tulip field, that's 1 acre of red tulips, 1 acre of white tulips, 1 acre of some other, you haven't seen it.